Hi. I'm robo-Suzie and today I'll talk to you about complications of diabetes. Also don't forget to check out the link below, to find out how this guy reversed his diabetes. Turns out, the diabetes industry is selling us fake research. But back to our topic. Complications of diabetes are the most vital health impacts of diabetes. Most of these diabetes complications are related to the bad effects diabetes has on nerves and arteries. Complications of diabetes related to artery damage are: I want to let you know that diabetes causes damage to both small and large arteries. And this artery damage leads to medical problems that are both common and severe. Amputation issue. You may be surprised to hear that around 82,000 people have diabetes-related leg and foot amputations every year. More than 60% of non-traumatic lower limb amputations are related to complication of diabetes. Foot care programs that include study examinations and patient education possibly will ward off up to 85% of these amputations. Diabetes complication of sexual dysfunction. Around 70% of all adult diabetic males presently suffer or will experience sexual dysfunction or impotence as a result of complication of diabetes. The cardiovascular disease. Let me inform you that diabetes victims have up to 400% greater chance of developing stroke or heart attack. About 65% of deaths among diabetics are due to this heart disease and stroke. These deaths rate can be lessened by 30% with improved care to control blood pressure, blood glucose and lipid levels. The eye disease and loss of sight. Every year, about 12,000 to 24,000 people lost their sight as a result of diabetic eye disease, which include retinopathy diabetic. Do you know that diabetes is the leading cause of new cases of losing of sight among adults between the age of 20 to 74 years? As a result, good screening and care can prevent up to 90% of blindness-related diabetes. The kidney disease. Each year about 38,000 diabetics develop kidney failure. Treatment to control blood glucose levels may possibly lessen diabetes-related kidney failure to 50%. Diabetes complications related to nerve damage. About 60–70% of diabetics have mild to severe forms of nervous system damage. This diabetic neuropathy could lead to tingling, paresthesias and numbness in the extremities and, less often, debilitating, severe, deep-seated pain and hyperesthesias. Below are examples of diabetic neuropathy. Dizziness. Your circulation should make some adjustments to move blood from your toes to your torso when standing up, because it is pumping against gravity. Once your body is working properly, this alteration requires tightening of blood vessels to prevent pooling of blood in your lower body. The circulation relies on nerve signals to figure out when to make this alteration. Diabetic peripheral neuropathy. The feet and legs can develop pain, loss of feeling or tingling. Problem like this makes foot ulcers and foot infections more common, adding to the possibility that an amputation may be required. Localized nerve failures. A nerve that controls a single muscle can lose its function. Some problems that might occur are eye movement problems with double vision, or drooping of the cheek on one side of the head known as Bell's palsy. The stomach and bowel problems. The nerves that trigger normal movements of the stomach and intestines can become less active. This can cause diarrhea, constipation or nausea. Diabetes complication of sexual function problems. Impotence is particularly common in people with nerve damage from diabetes. Artery damage plays a part to impotence as well. Additional diabetes complications. Pregnancy as a diabetes complication. Be aware that around 18,000 women with pre-existing diabetes give birth to babies every year, and an estimated 135,000 expectant mothers are diagnosed with gestational diabetes. All these women and their babies have an increased risk for severe complications. More complications include diabetic complications of flu and pneumonia-related deaths. Every year, 10,000 to 30,000 diabetics pass away due to the complications from flu or pneumonia. They are more likely 3x to pass away due to these complications than those without diabetes. Lots of these possible complications of diabetes can drastically shorten the life of a person with diabetes, and all of them can diminish the quality of life. That's it. Thank you. Please subscribe, comment and like this video if it was helpful. See you soon.